Words that would be crippling for any woman to hear. You have breast cancer. Words far too many women have heard. In fact, 1 in 8 women in the U.S. will develop breast cancer in her lifetime. That's according to the National Breast Cancer Foundation. It's the most common cancer in American women behind skin cancers. And men get it too. Now, October is National Breast Cancer Awareness Month, and one woman who knows a whole lot about this is Carrie Kellams, who joins us now in the studio. Carrie is a nurse navigator at the Peninsula Breast Center. Thank you so much for being here
Thanks
this
for
afternoon.
having me. I appreciate it.
Just reading those statistics, they're pretty scary.
It's very scary. I think many people will be surprised how many people they see day to day that have been affected by breast cancer.
So is this why it's so important to make more people aware of breast cancer?
Absolutely. I think the main reason we want to focus so much on awareness is because we want cancer to be detected early. The earlier we detect it, the better women do.
And do you think there's people out there who just think, you know, it couldn't happen to me?
Absolutely. I think most women think that it's not going to happen to them. Nobody expects to hear those words.
Now, nurse navigator. I've never heard of that title before. What do you do as a nurse navigator?
So our main role is to be a resource to women or patients or family members. We want to help expedite their care as much as possible. After you have abnormal imaging, it can be really scary. You don't want to wait a long time. So we try to reach out to people very quickly, get their biopsies scheduled quickly. And then if they do, God forbid, come back as something that needs to be taken care of or treated, then we try to get them set up with whoever the most appropriate person would be, usually a breast surgeon, as quickly as possible.
Yeah, and those are typically the medical things you have to deal with.
Right.
But there's so much more when you get a breast cancer diagnosis.
Absolutely. It affects every aspect of your life. I think as women, especially, we tend to want to be caregivers. We take care of our partners or our children or our family members, and oftentimes we neglect ourselves or our own health or our own breast screenings or mammograms, imaging. And once you get a diagnosis like that, you have to kind of change roles and really focus on making yourself a priority.
That's hard for a lot of women to do, isn't it?
It really is.
Yeah, yeah. You know, every October, Breast Cancer Awareness Month, we see a lot of pink, so there is a lot of, I guess, outreach out there for the disease. Do you think it's working? Are things getting better?
I do. I think that the earlier we detect cancer, our technology has gotten better. At the Peninsula Breast Center, we have now 3D mammography, or tomosynthesis is what it's called, and it allows us to catch cancer very, very small, smaller than we ever have before. So while we may be seeing more diagnoses because we're catching it earlier, we're seeing better outcomes. So
people are living.
Absolutely.
That's wonderful. Okay, let's back up and go to prevention. What can we do to prevent breast cancer?
Certainly there are some steps that you can take. Some of the most important things is maintaining a healthy weight, and goes right hand in hand with that, a healthy diet, low in processed foods, lean fats, high in vegetables and fruits, things like that. Limiting alcohol intake is really important. Exercise, exercising about 5 days a week, 30 minutes a day is really important. It can help reduce your risk. And often we forget one of the most important things you can do is not smoke. So smoking cessation. Everybody knows that smoking is linked with lung cancer, but I think we forget that it's linked with other cancers as well.
So just live a healthy lifestyle.
Absolutely.
Thank you so much, Carrie Kellams with the Peninsula Breast Center.
Thank you.
Good information indeed.